So the aim of our study is to validate and refine the CIRI models for CLL in the context of fixed duration targeted therapy and to benchmark performance against other established indices. So the idea is that measurable residual disease status after limited duration therapy is an established prognostic factor for survival times, but most prognostic indices rely solely on pretreatment feature. So to incorporate dynamic MRD data into prognostic models across cancer types, including CLL, the continuous individualized risk index, or CIRI, was previously proposed. So using a Bayes-Cox model, CIRI dynamically determines outcome probability for individual patients by integrating diverse risk features over time, so which includes treatment modality and serial MRD data on and post-treatment. So things developed in the context of chemoimmunotherapy, we here propose a refined version of the CIRI model, the so-called CIRI2-CLL, in the context of fixed duration targeted therapy, which includes MRD status on treatment, at end of treatment, and on addition, 12 months post-treatment. So after developing model parameters from the CL8, 10, 11, and RANO trials, we applied the refined model to an independent validation site from CL14 trial and benchmark performance against other individual indices. So in the full CL14 validation site, CIRI2-CLL showed adequate calibration with about 5% difference between observed and predicted event probabilities. So with 21 to 31 higher statistic compared to CLL-IPI, outperforming MRD and other single factor indices. So the performance was maintained in CL14 patients treated first line with Venetoclax and Obinutuzumab or Ven-Obi. So additionally, CIRI2-CLL allows for clear separation of high-risk patients from intermediate and low risk, with corresponding 3-year PFS rate of 17%, 70%, and then 100%. So furthermore, when grouping into trials by predicted risk, 16 to 20% of patients were recategorized to higher or lower risk by CIRI2-CLL compared to CLL-IPI. So MRD status alone missed substantial risk heterogeneities. For example, 46% of Ven-Obi patients with undetectable MRD had intermediate CIRI2-CLL risk. So the performance was maintained for overall survival. In conclusion, our results validated CIRI2 in the context of a limited duration treatment and suggest adaptivity with emerging additional longitudinal outcome data. So with CIRI2-CLL, we offer a tool for investigators to reliably identify patients with increased risk of disease progression after Ven-Obi.